Welcome to Emerald Coast Dermatology. We know that trust is more than skin deep.
Our letterhead displays our self-designed logo. We have chosen to create a picture of a sun because we are located on the sunny Gulf Coast. The sun is also designed to simulate a fingerprint, which serves two purposes. It highlights the fact that we're a business in the business of caring for the skin, and it's a reminder that, like fingerprints, each patient is unique and requires a dedicated approach to care. Along with the logo, our letterhead displays our contact information. At Emerald Coast Dermatology, our mission is to be the premier provider of compassionate, quality healthcare. Our vision is to be independently recognized as the most sought-after provider of comprehensive dermatological healthcare by patients, physicians, employees, hospitals, and carriers.
Our SWOT analysis demonstrates a clear picture of demand for our services in this location. While we are dependent on the hospital for our offices, the benefits of our affiliation are opportunistic. We anticipate an increase in our care and services due to the Affordable Care Act. This will lead to increased staff and space. Consequently, we will be proactive in keeping up with administrative regulations.
At Emerald Coast Dermatology, we use bureaucratic principles to efficiently manage the clinic and staff. This management style works well because our clinic is a small, stable, and predictable environment. As managers, the physicians, nurse, and office manager plan, organize, staff, lead, and control the operations of the clinic. Here is our clinic floor plan. The evacuation route is highlighted, and the location of fire alarms and fire extinguishers are clearly marked.
Our clinic is designed to support a calming, healing atmosphere while meeting ADA, OSHA, and HIPAA guidelines. The blues and greens have a calming effect while touches of yellows and reds yield a bit of energy. The light wood tones are welcoming and friendly. The reception desk is slightly partitioned from the waiting room, which provides ample privacy for the staff and patients. The reception area is designed to allow patients to relax or work as they wait to be seen. We have included charging stations and guest Wi-Fi. The furniture is covered with durable antimicrobial surfaces, and the walls are enhanced with additional sound barriers. Our physician offices and examination rooms are, again, incorporating the calming colors of blue and green. We have chosen standardized spaces that are multifunctional and adaptable to special needs. These spaces are easily accessed and modified for electrical and mechanical systems.
Emerald Coast Dermatology's Emergency Preparedness Plan is linked to both the Neighborhood Hospital and Escambia County Emergency Management Plans in order to enhance planning and preparedness. Our plan has been reviewed and approved by local agencies. We are a participant in the National Disaster Medical System Plan. Here we have shown our table of emergency codes, along with their definitions and the procedures to follow when one of the codes is announced.
At Emerald Coast Dermatology, we care about more than just the dermatological needs of our patients. We gladly provide our clients with emergency information as well as contact information for a variety of community resources to meet their needs.
Our workflow is fairly standard. Our patients are greeted, established patients will have their information verified, and new patients will have all their pertinent information captured. Following that, the patient's vitals will be recorded. Next, patients will receive care, service, or an office consultation. Lastly, the patients will be directed out to the checkout desk to finalize their visit. We anticipate seeing approximately 20 patients each day. The purpose of our patient satisfaction survey is to help us to identify areas of improvement. It also indicates to our patients that we are genuinely concerned about their experience at Emerald Coast Dermatology. Under the HIPAA privacy rule, a patient notice of privacy is given to each of our patients. This notice informs patients about how our office may use and share their health information, and it informs them about how they can exercise their health privacy rights. If our patients have any questions or issues, they can be directed to our privacy office.
Our patient information brochure displays our logo, address, office hours, and all points of contact. The back cover states our commitment to our clients, which coincides with our vision and mission statement. On the inside of our brochure, we have listed our 3 dermatological divisions: medical dermatology, surgical dermatology, and cosmetic dermatology. We have explained the importance of these divisions and have given examples of services offered under each. This brochure is beneficial to us because it presents clear, concise information which prospective patients can quickly find to help them make a decision about our practice.
At Emerald Coast Dermatology, we use the functional organizational structure. This structure uses a strict chain of command and line of reporting, which ensures that communication, assignment, and evaluation of tasks are carried out in a linear command and control environment. This structure offers key advantages, such as specific divisions of labor and clear lines of reporting and accountability.
This is our office manager, and here we have listed some of her duties. Our office manager is involved in all of the day-to-day administrative tasks required to keep our practice running smoothly. She does not work with patients. Instead, she focuses on the business aspects of operating a medical office, with duties that include ordering supplies, hiring staff, and budgeting. A healthcare office manager can be quite active because the job deals with so many of the behind-the-scenes tasks in a medical office. Just like an office manager for any other business, the healthcare office manager must be a critical thinker who can communicate effectively. To excel at the job, a manager also must be familiar with the healthcare system.
Employees will be evaluated annually on 9 performance categories, including quality, desire to improve quality, job knowledge, communication, interpersonal skills, teamwork, ethics, initiative, and conflict resolution. Employees will be rated using a scale of 1 to 5, where 1 indicates improvement is needed and 5 indicates exceptional performance. In order to manage risks, the practice managers will ensure that all employees are properly trained and credentialed before hiring and throughout employment. All employees will be screened prior to hiring. Employee files will be maintained to include references, credentials, licenses, training, and evaluations. New employees will have a 90-day probation period during which they must show proficiency of assigned tasks. Annual training will be provided in the areas of confidentiality and HIPAA privacy regulations, patient safety, and harassment.
Here is our personnel folders policy. We prepare a personnel folder for each employee. Here is a list of the items that may be included, such as the employment application, performance evaluation, and confidentiality statements. Individual files are handled as confidential information at all times and kept in the administrative office. Employees who wish to review documents in their personnel record can make an appointment with the administrative office at any time. This is our conflict resolution procedure. We believe problems arising in the workplace can often be easily resolved through effective communication. If our employees have a complaint or suggestion for improvement, we invite them to talk to management immediately. In an effort to streamline the resolution of complaints and problems, the practice has established a conflict resolution procedure. To be effective, this procedure must be closely followed. Here we show the 3 steps of our conflict resolution procedure. Policies and procedures are the link between the HCO's vision and its day-to-day operations. Well-written policies and procedures allow employees to clearly understand their roles and responsibilities. They also allow management to guide operations without constant management intervention. With a policy manual, managers and supervisors will be able to act decisively, fairly, legally, and consistently. Employees will also know that their managers or supervisors are acting in accordance with municipal policy as well as applicable federal and state regulations. This concludes our tour of Emerald Coast Dermatology. Thank you for visiting with us today. We hope you have enjoyed learning about our practice and that you will consider us for your future dermatological needs. Have a great day!